We're going to dig more into the question about the corona pandemic and its consequences for welfare development. And we'll start this session with very interesting questions. How has the public debate been in Denmark, Sweden, Norway, and Finland during the pandemic? What have been the main concerns in media and in the media debates about the survival of the welfare society? Matilda Hellman has made an analysis of the media image and debate on the design of the welfare state. How is the welfare state doing? Matilda Hellman is research director at the Faculty of Social Sciences in the University of Helsinki. Please, Matilda, the virtual stage is now yours.
Thank you so much. I hope you can see me. Please shout out if you don't.
Can see you and hear you, Matilda.
Can you see my screen also?
Yes.
Very good. Okay, so I'm going to talk about in pandemic times and in times of transition, how the Nordic welfare state is doing. And I will start by showing you a picture of Robinson Crusoe, who is a protagonist in a very famous novel. And it is Hungarian social semiotics Lubomir Dolencel who has spoken about how we perform rational action when dealing with the unknown. And he points out that Robinson Crusoe doesn't force himself on his environment, even though it is very unknown and dangerous, but he goes on to observe, collecting information, and taking protective action to neutralize its potential destructive features, and also his failures when trying to change his circumstances become a pathway of knowing. And what is orienting him is a mental image of pre-island life and how it can be to live life somewhere that is not in this situation. And this is also a image that we use in a recent book that we have published, or it's coming out very soon, and where we are stating, we are looking at how different parts of the world handle the corona crisis and how we oriented ourselves towards this kind of image of a pre-corona life. This is the book. There's a lot of text in this slide, but you can just notice that there are 8 countries that we have as cases. And we looked at the first 10 months when the societies were trying to understand what was going on and somehow block the developments in order to save some time to plan. Of these conclusions that we draw, we have 7 conclusions. From the Nordic society's point of view, I would say that especially the conclusion number 1 and number 4 are extremely important. And it has to do with the social contract that we have in our societies, and also the epistemic and institutional seating of governance modes that we have in our Nordic welfare states. And just as a reminder that this is not ad hoc how we start to work in a pandemic and time of transition and crisis, but it has something to do with our social contract and the institution at place when we start taking care of the situation when it's escalating. So I'm going to concentrate my speech on 2 questions. The first one is something that Jens already mentioned, that we have a little bit different situations when it comes to how we perceive the welfare state and its tasks and its legitimacy and accountability in the different countries. And this is the situation where COVID-19 landed. And I studied for 4 countries: Norway, Sweden, Denmark, and Finland. And then I will try to talk a little bit what it means, this institutional and cultural seating of the COVID crisis. And there I'm going to go into one of the chapters in our COVID book where we compare Finland and Sweden. And I just wanted to add a small parenthesis where I explain, because I may be a little bit different grasp in my research than other speakers here in this forum. I see resilience of a society that can be assessed and measured in welfare state accountability, which is VSA, which I claim is built on certain parameters in a society. I give this social contract a very central role, and then the system literacy, the ways in which the public understands the society in which they live, as a kind of measure of strength of the popular support of our system. And also other important features that I use in my research is the autonomy of the executive branch, which is very, very high in the Nordic countries, and also the concept of epistemic projects. Just as a backdrop. So in what sort of Nordic welfare state related situation did the pandemic land or occur, maybe? This is a study that I've just released, and it's been published actually online today. And it's published in the journal Nordic Välfärdsforskning, Nordic Welfare Research. And I there went through the public constructs of the Nordic welfare state as a project and an object to relate to in 4 societies. And I looked at the period 2014 to 2020. So this is just before the corona started to escalate and made its entrance in our societies. And the funny thing is that we have in our countries a little bit different views on what this collective contract is all about. In Denmark, there was this sort of transactional view where priorities in public governance are to be seen in a view of funders, who is paying, who has the right to take advantage and enjoy the services. So there's a transactional view. And this is, of course, very extremely simplistic version. You can read the text, and you can also, I think it's in the chat now, also a link to it. In Finland, I saw that there was this over-generational spanning view that the Nordic welfare state is a model that furthers people's possibilities to work themselves up in comparison to their parental generation. And also it secures social security over time. In Norway, there was an emphasis on sustainability and a long-term historical project of the welfare state that was built over time around notions of solidarity and community. And in Sweden, the popular discourse would pick up on the value-based social trends that are threatening and challenging the welfare state. And that could be like marketization, neoliberalization, or privatization. So there was little different ways of looking at the Nordic welfare state in these countries. But overall, there were worries about the welfare state system's future and resilience, but also some great pride over how well the Nordic welfare states were functioning on in a global perspective. So if we now turn to this kind of institutional seating of the pandemic and how it differed between countries, I have compared Finland and Sweden, and I've done this together with my colleagues Saara Salmivaara and Janne Stonam, and it's part of this book anthology that I showed in the beginning of this presentation. So we looked at the communication from public health authorities during the corona pandemic from the THL and from Folkhälsomyndigheten. THL is the Finnish Institute for Health and Welfare, and then public health authorities in Sweden. And maybe the title of this paper already gives away a little bit. The title is Calm Chess Player or Self-Aware Administrator. So our message with this research is that the communication from these authorities was so important for how the corona actually materialized in our societies, that they somehow made the corona crisis by communicating the crisis. And there are some really, really interesting differences. In the communication from, one more thing about the previous slide that you have to keep in mind, that these two public health agencies have different roles. For example, the Folkhälsomyndigheten does not have the same explicit social policy responsibility as THL. So there are, and we also discussed this in our research. Nevertheless, it's very interesting to see that how they position their own role in view of this virus spread. In Finland, there was a focus on changing reality and unknown futures, just as Robinson Crusoe didn't know what was going to happen. The problems are not known in advance and have yet to be solved, and THL is doing its best and will regularly update the public. The message was, nobody knows what will happen, stay tuned. We will try to know how to deal with this and learn. The public health agency in Sweden had a little other kind of communication. They focused directly very much on themselves as a competent actor, and emphasized that they knew what was going on even before the virus has started to spread in January, and before the nature of the virus was fully apparent. So the message was here, it was not better or worse. It was just another positioning when you speak to the public. It was more calming, like, we've got this covered, don't worry, we know what we're doing. And I just wanted to take in this little Robinson Crusoe here, because so that you see what this means when you start working with an environment that is unknown and a situation that is unknown. When it comes to the communicative style and the speaker position, I will start by telling a little bit how THL in Finland communicated. They had this kind of contextualization where they let the public know how the agency's action relates to the pandemic situation as a whole. So they communicated what's going on and then what is being done in view of what is going on. They also had a very great emphasis on a pedagogic explanation, explaining what's happening in society during the crisis and how it relates to the work that the agency does. Well, this is basically the same content as in the first point here. And interestingly enough, and what also pertains to the THL's role in society and its legal role as an organization and an institution, it addressed the public directly and gave advice. For example, if you are a victim of domestic violence, you can do this and that. There were great lists of how you can act and where to go and how to do things. And we also saw a sort of system reference and a social ethos in a way that they speak about many different parallel traits going on and strategies and the social political consequences for the most vulnerable groups were explained. Now, remembering that the role of the THL is a little bit different than the Public Health Agency in Sweden, then Public Health Agency in Sweden very much focused on administrative cooperation, samarbete and samorganisation, co-organization between sectors and different authorities in Sweden. It communicated its undertaking as if the main point is to communicate its undertakings. And by this we mean that sometimes a press release could be that Folkhälsomyndigheten has been in contact with this agency. So it was less about what's going on and what are we doing about it, but also like it is communicating to the public that we are doing as we should and what is expected of us as the legal entity in this welfare society that we are part of. The audience addressed was a little bit vague to understand what it was. It also appeared to be other public institutions. And this is also, I'm not saying that it's a bad thing, but it's more in line with its task in the Swedish society to have this samordnande and information collective role. And the system reference and the social ethos would mostly concern things like keeping hobbies open and sports and youth activities up and running, which was important from a public health perspective. So the social policy perspective was not as prevalent as in the Finnish authorities' communication. So we thought that, or we also took a look at other authorities and agencies in Sweden that were communicating these things. And for the citizen, this means that they needed to look up different places online if they wanted material. And we conclude that perhaps it was more available, the whole package and information of a situation where there were many different aspects and involved. So this is the comparison that we made between these two countries. So to conclude, we can see that corona pandemic materialize or land in different contexts in which authorities have taken rational action in view of the unknown. And this is not ad hoc, but it societies actualize the system they already have. And what is really, really important in this is the views on the social contract and the welfare state as a functioning system in our societies. And in the first analysis that I talked about, I showed that there were quite different understandings of the welfare state as a project and an object to relate to in the 4 countries that I studied. And this also held true for Finland and Sweden during the corona. You could see that the social contract and the institutionalized way of handling public health issues were a bit different, and there were different mandates between the public health authorities in these 2 countries. They have different role and tasks, and it reflects in communication by the authorities and how the pandemics are handled also. And I think there's a real need for next steps to this research and taking a look at the Nordic welfare states more thoroughly from this perspective of accountability and understanding how we have certain values inscribed in our institutions and in the social contract that makes us different and also make us more different in how we react and how we integrate different solutions to different questions. Here are some, I've been writing about this a lot, and here are some of my work. And I also today posted on Twitter this last paper, and I've also posted about this book there if you are interested in it more. Thank you so much.
Thank you, Matilda. Really fascinating work you've done. I have a question for you, if it's okay.
Of course.
Well, we have this Finnish style, as you called it. Nobody knows, stay tuned, kind of. And then this Swedish style, we know, don't worry. But when you look at Denmark and Norway, would you say that Denmark and Norway are more kind of like the Finnish style or the Swedish style in communicating?
We didn't look at those in the corona pandemic, but I think when it comes to this buying some time and shutting down society in order to wait and check what is this all about, how are we going to do this strategy, I think Norway and Denmark, at least in the beginning that we looked at, might have more resemblance to Finland.
Yeah, I think so too. Very interesting, Matilda. And the article you referred to, I think Judith also posted it in the chat, so you'll find it there. Thank you very much, Matilda Hellman. One key word when we or you traditionally describe the Nordic welfare model is trust. Trust is also sometimes called the Nordic gold. We generally and usually trust our governments and institutions. But is this changing? How have we reacted to the policy implementations during the pandemic? Helena Kroll-Blomberg is a professor at the University in Helsinki. She will now talk about the Nordic welfare state policy implementation and trust. Please, Helena Kroll-Blomberg, the stage is yours.
Thank you, and good afternoon to everyone. You can hear me, I hope?
Yes.
Thank you. Well, yes. The Nordic welfare state policy implementation and trust, and I will speak quite much about policy implementation and something about trust, and I will start by saying some words about my starting points for this presentation, and then I will share you my PowerPoints and you know the usual stuff. But of course, my starting points they relate to previous contributions we have been listening to today. As already been said, that the Nordic countries are characterized by high levels of trust, both so-called social trust, usually meaning that people feel that they can trust most other people, and the Nordic countries are also characterized by trust in institutions. People living in the Nordic countries are, well, some say at least that the words most trusting people, which is seen as an important precondition for the ability to cooperate and to work together, especially in times of crisis. And as Jens already said, trust has been seen as a Nordic gold. It should be nurtured and it should be properly maintained, and that would make the Nordic welfare states also strong in the future. And then, of course, we have the World Happiness Report. I think it was referred to earlier today, that states that successful COVID-19 strategies include trust in public institutions. Trusted public institutions are, for example, more likely to have their population support the required actions during the pandemic. So, but a part of public institutions are usually named street-level organizations or frontline organizations. And when crisis strikes, these organizations form the, well, let's say the frontline response. And in these moments, their work become both vital and more visible. And this is also what has happened during the pandemic. Frontline workers, teachers, social workers, healthcare workers, the police, and so on, they have been usually seen as public heroes. So the pandemic, during the pandemic, these frontline workers, they have gained a rather broad recognition for their essential contribution to society. And this is not always the case. This image of frontline workers as heroes serving the frontline and risking their lives to help citizens is not the usual image when it comes to how frontline work and workers are usually treated in the public discourse or in the research. I myself, I educate social workers, and I've been discussing with my students at the master level. They are already working as unqualified social workers, many of them, and they have been surprised that now their work is much more valued and recognized than before, and still they are doing much the same things as usual, but also things that they were not used to do before the pandemic. Well, anyway, this presentation is about the frontline workers and then how they implement welfare policies and what has changed during the crisis. And then I will perhaps try to relate it to has something happened with the trust in institutions. So I will start sharing my presentation, and I will hope that you will all see it. So, okay, I hope it's okay.
It's okay.
Yep, good. So this is actually the things I was already talking about, but about the vital role of frontline workers or state bureaucrats providing essential services to citizens, and because they are the operational arm of the welfare state, and how they respond to and act in crisis, the matters for welfare policies and politics, even if we usually perhaps do not think about these things when we think about the future of the Nordic welfare state. Frontline work and citizens, they create the basis of citizens' trust in institutions, also for the welfare state in general. And of course, if you, as a citizen, client, user, if you trust policy implementation, probably the service delivery will also be more successful, and there is trust and cooperation between the frontline workers and the clients. So that's just as a background. And as I already said, this is perhaps more I'm repeating myself, but crises, they often highlight the importance of frontline work and frontline organizations, since the safety and well-being of a society and trust in institutions, and thus also in the entire welfare state, depends on how frontline organizations and their workers respond in practice to the crisis and to different governmental instructions and actions and guidelines. And what I'm interested in my presentation is that we know quite much about how street level bureaucrats or frontline bureaucrats, I see them as synonyms, what they do when they are doing their job in ordinary times. But the question is, of course, that how do frontline workers act and react under very extraordinary conditions? What happens when they are trying to implement new directives or old directives in very much changing situations? So I won't go into so much about the frontline theories. Most of you probably are familiar with the concept of frontline workers, and you are familiar with with the seminal work of Michael Lipsky over 40 years ago. He introduced the concept of frontline workers and street-level bureaucrats and defined them as public service workers who interact directly with citizens in the course of their jobs and who have substantial discretion in the execution of their work. Well, not all researchers agree that frontline workers have a lot of discretion in their work, but mostly people working as teachers, social workers, etc., have some kind of discretion in their work. It's in the nature of being a frontline worker, and of course the question might then be that what happens when a crisis like the pandemic now has struck society, or how do frontline workers react, or the opposite, do not react. And of course, it's also clear from previous studies that there is always some kind of tension performing the frontline work, because you have to balance between policy implementation demands, the demands from instructions, from decision makers, from the managerial level, and then of course you have the clients with their different needs, and there's always some kind of shortage of resources, and many frontline workers feel that they are, in the middle of demands from up there to be efficient and to follow the rules and so on, and then we have but then there are also the individual clients with their demands and their sometimes very difficult situations, and the frontline worker is there between these demands. So the focus of my presentation actually, well, it lies or is about the role of frontline workers. Are they trust generators? Are they policy makers? Are they crisis solvers, and so on? What has happened during the pandemic? And then this is just a brief presentation, just a start of perhaps something that should be researched to a much greater extent than I have been doing so far. But of course, the background is that crises they are disruptive, and they are characterized by uncertainty and urgency, and usually frontline workers they work with certain routines they have developed, and the organization has developed, and then these crisis disruptions they can produce totally new patterns of frontline practice. It can be good practices or it can be bad practices, but certainly they might lead to new structural arrangements within the welfare state, and we really don't know at the moment what has happened really when work in different kinds of welfare institutions had been changing due to the crisis. So I will briefly try to answer the main question here: what happens when crises disrupt practices and routines in welfare state policy implementation, and do frontline workers behave and act differently in a crisis? And then I had a question: what are possible consequences of this? And while I was writing this paper, I figured out that the last question is totally impossible to answer at the moment, but I will give you some questions to reflect on, and my presentation is based on I would call it a rapid scoping review. I've been looking through different international studies about what has happened to frontline work. This is not a presentation about what has happened to frontline work in the Nordic welfare state, because there has not been published that much about the subject yet. This is a more general overview that I'm going to briefly present. I have tried to categorize different responses frontline workers have had and made during the pandemic into 6 different categories, and I will try now to briefly look and explain some more about these changes. First, what you can see from previous research is that studies that focus on the ways through which frontline work is carried out during a crisis emphasizes that frontline workers, they experience increased policy ambiguity. There's a lack of information that is quite highlighted in many of the international studies I've been looking through. Frontline workers working in the middle of the pandemic, and there were no information at all what they should do and how they should react. Other studies found out that the frontline workers, they received very contradictory guidelines. They got local guidelines, they got guidelines from their own organizations, from the municipal level, from the regional level, and then from the national level. And it was really hard to navigate in this landscape when there were so many instructions, and many of the instructions were also rather vague. That resulted in what I call here the increased policy ambiguity. It was hard to navigate and to follow instructions in the same way as before, and there were so many rules, or then there were lack of rules what frontline workers should do in different new situations. And of course, there were also communication and coordination problems. Of course, since the guidelines and instructions were vague, or there were so many from different levels, also the communication, that there were also communication problems, which frontline workers felt that were really hard to work with, to regard in their daily life. Also, many of the studies, and this is of course no surprise, we know it all by heart, that many of the available studies on frontline work in times of crisis, they demonstrated that formal policy decisions, they required additional and modified tasks. Was there a question?
No, please continue.
Yep, okay, it was just a way. Okay, and of course, the studies they're showing that so many of the frontline workers, they received additional tasks that they were not used to do before this, and different directives, and this of course resulted in a very high workload for many professional groups. Then we have the second type of changes when it comes to frontline workers work. I've been calling it fast policy making and increased downward and upward flow of information, and of course fast changing circumstances, they need fast policy making, and fast policy making needs good communication between decision makers, managers, and frontline workers, and there should be communication upwards and downwards. And the downward flow of information is vital because frontline workers' understanding of the very fast changing conditions in society is of course of importance in order to work very effectively and efficiently and with clear goals, and frontline workers were thus dependent upon updated, coherent information provided by higher ups. And depending on which country you study and which type of frontline work you study, you can see that in some cases this information from upwards or actually from the downward flow of information, it functioned very well. And then there were studies showing that there were no communication to the frontline workers. They really didn't know what to do in different situations. And then the upward flow of information is, of course, the information that the frontline workers try to so to say, get to the decision makers and to the managers. Upward information, the field of decision making is essential in order to adapt policy design to the constantly changing conditions on the ground. And there seems to have been a shifting attention to frontline workers as important sources of information for policy design during crisis. So in contrast perhaps to normal times, it seems that decision makers and managers were more keen to listen what the frontline workers said, what is happening on the ground floor, and which groups in society are having very difficult times at the moment, and so on. Then increased discretion, yes, for some groups and in some countries there were, because frontline organizations and workers were given expanded discretion. They got more tasks, and also in cases where there were a lack of instructions and guidelines, the frontline workers thought, well, we are doing what we can. We are professionals, and we will try to solve this. So they started to do things that they usually hadn't done, and in a more flexible way than before. But then again, there are other studies showing that in some countries and in some sectors, the frontline workers receive very strict guidelines what they should do and what they were not allowed to do. So in some cases, there were also a decreased discretion in the work of frontline workers. Then there's something I've called the disrupted routines. And of course, the background is that crisis may also change established routines, since crises produce new and rapidly increasing demands, creating urgent resource needs. And when changes are sudden and substantial, they are likely to disrupt in formal routines in ways that are rather unpredictable. You can't work as you used to do. And when routines are disrupted, you can react in different ways if you work with people in different situations within healthcare or in the social services and so on. And some frontline workers, they adapted to this new situation by, for example, they extended shifts and hours. They worked far too much, perhaps. They took tasks that were somewhat outside their specialties because there were no one else there, and so on. They really tried, to stretch and adapt to the new situation. And of course, which also the public were very much aware of, and there were all this discussion about the pandemic heroes and so on. And of course, the difficult question is, of course, that whether such efforts were and still are they sustainable over time, or are they perhaps also, I mean, for how long can this situation go on? Then other frontline workers, they resisted. I'm just looking at the clock, and I will try to be rather brief. They resisted old routines, and they created new routines. and they broke the rules and tried to know what was morally right to their mind, and some of them then tried to adopt and develop not old routines but new routines and innovations. What studies also showed, I'm sorry about this, is that people with a very professional background, a long professional education, seem to have been adapting to the situation better than those who did not perhaps have a very long education. And the sixth point, the disrupted structural welfare arrangements, I won't go into that because that has to do with what happens with the services in the welfare state in a longer perspective. If we have frontline workers who are now working in new ways, they are resisting, they are making innovations, they have perhaps increased discretion, they have taken additional tasks and so on. How will this in the long run change the whole, let's say, the Nordic welfare state, if there are many, let's say, creeping changes in how people receive their services and welfare tasks. I had a slide, but I think my time is running out. This is from a Finnish study among social workers, and here you can see that the social workers in this interview study, they saw that a lot of things had happened in their work. They saw that there have been positive things during the pandemic. They have been adapting themselves rather rapidly to the change, and they made use of their professional knowledge and competence, and they saw that they could make use of their flexibility, but then there were internal weaknesses, the things I just mentioned. There were inadequate crisis management, and there were problems with communications, and there were no proper infrastructure to interact with clients, for example, online and so on. There were increased tension within work team, and there were new pandemic-related tasks, which were rather heavy and so on. So I will actually say this is just some of the conclusions. We have the pandemic fog dilemma. We really don't know what is happening when it comes to implementation of welfare policies. But we can see that there are different consequences for state level or frontline work implementation. There is increased policy ambiguity. There is a higher exposure to risk. There is possibly increased discretion, or then there is decreased discretion. We really don't know yet. And there are disruptive routines, there are extra tasks and circumstances leading to new strategies, adaptation, resistance, and innovation. And we have this fast policy making, and we have new flows of information going upwards and downwards between those who are making the decisions and those who are implementing them. And then there is the importance of professionalism. Those frontline workers having a strong professional basis, they seem to have survived the pandemic to, let's say, a greater extent than others. I think I will close my presentation here. When it comes to the relationship between policy implementation and trust, I think it's too soon to say something. The knowledge on trust and policy implementation, it's at the moment it's disparate, it's partly contradictory, and based on data collected at the beginning of the pandemic. But it seems that in high trust countries like the Nordic countries, at least at the beginning of the crisis, no matter what the government did what the authorities did or what the frontline workers did, people trusted them very much, regardless what kind of strategies it was. I mean, people in Sweden trusted the Swedish authorities and frontline workers, and people in Finland, as an example, trusted the Finnish strategy and the authorities and so on. But what we do not know is that will this change when the crisis probably will continue for some time, also after this presentation and these days. But I will stop here and thank you for listening to my presentation. Thank you.
No, thank you, Helena. Very, very interesting findings